Diseases, once thought to be eliminated from our society, are returning because parents are not having their children vaccinated. Most of us have had a vaccination sometime in our life, whether it be for chickenpox, for the flu, or for hepatitis. But there are some people who have not had all of their vaccines. I believe that the Minnesota Department of Health should create a vaccine mobile that would make receiving vaccines easier and more cost-efficient for families. We will first be discussing what exactly the issue is with the vaccines. Second, we will be talking about the causes and why vaccines are such an issue. And finally, we will be talking about how this problem can be resolved. Parents who are not having their children vaccinated are creating an unnecessary risk for our society. According to Amy Wallace's article, An Epidemic of Fear, on Wired.com, posted October 19, 2009, 2.6% of our population has not been properly vaccinated. This was a large increase from 1991, when there was only 1% of our population that had not been vaccinated. The laxity of our health department is a major cause for this. According to Bellybelly.com, a website for expecting mothers, last updated in 2012, in all 50 states, people are allowed to omit vaccines based on religious beliefs. But according to Douglas Dinkman from the Michigan Law Review, published in 2012, there are still 20 states that allow people to omit vaccines based on personal beliefs. The parents who are omitting vaccines from their children's health care are creating a danger for our society. According to vaccines.gov from the U.S. Department of Health, published in 2012, vaccines are not 100% effective. There is still a small chance that someone who has a vaccine can still get the disease. A worst-case scenario happened in California, according to Jennifer Steinhauer's New York Times article, published on March 21, 2008. A small preschool class of 12 students all received measles because one student had not been properly vaccinated. There are many reasons why parents are not having their children vaccinated. Some parents believe that vaccines are more harmful than they are helpful. Again, according to Bellybelly.com, some parents believe that vaccines have not been properly tested and therefore do not want them put into their children. And according to MSNBC, published on November 29th, 2011, some parents believe that vaccines cause disabilities and diseases such as diabetes and autism. Even though these parents are dead set against not giving their children vaccines, some parents are not administering vaccines in their children because of other reasons. Again, according to Bellybelly.com, some parents are not vaccinating their children based on the cost of the vaccine. And according to Childhood Vaccines on the Mayo Clinic website, posted on August 2nd, 2011, some parents are not having their children vaccinated because of the inconvenience of driving to a healthcare facility. I know that there are those parents that are completely against giving their children vaccines, but those aren't the parents we need to help. We need to be able to help the parents who the cost and the inconvenience is affecting. I believe that the Minnesota Department of Health should create a more easy, cost-efficient way for parents to have their children vaccinated by having a vaccination mobile go to different preschools and schools throughout Minnesota, administering low-cost vaccines. This will be a good idea because the more people that are vaccinated, the healthier our society will be in the future. This is very practical because a system like this is set up already through the Red Cross. They go around with a blood drive like we recently had, and they allow donations. The Minnesota Department of Health would do something much like this by using a van and bringing it around to different preschools and setting up in the gym where parents can bring their children, which is very convenient because they have to go to school, and the cost would be very low. This would be very beneficial for everyone. It would be beneficial for the children who are receiving the vaccines, who would otherwise probably would not have them. And it will protect the students who already have their vaccines from their small % chance of getting the disease. Parents who are not vaccinating their children are creating a major risk for our society. I think that we should make it easier and more cost-effective for parents to have their children vaccinated by having the Minnesota Department of Health create a vaccination mobile that can go around to different preschools administering low-cost vaccines, very convenient. If diseases are coming back into our society because people are not having their children vaccinated, if the Minnesota Department of Health makes this vaccine mobile standard, we will save many lives.